Obesity is a complex disease that occurs for multiple reasons and, when untreated, often progresses over a child's lifetime. In general, obesity occurs when we take in more calories than we use every day, but we as healthcare providers know there's much more to the story than that, especially for children and teens with this condition. These include a combination of internal factors, like a person's genes and hormones, the hormones in particular that control appetite and control that feeling of fullness after a meal. But there are also many external factors, medications that we may have to take, access to and eating the right kinds of nutritious foods, our sleep patterns, and our ability to get high quality sleep that restores us every day, and last but not least, having safe places to get exercise and that sense of well-being that you get from good physical activity. When we think about treating obesity, the message is often eat less, move more. But it's really not that simple.
There's been a steady increase in childhood obesity over the last several decades, especially here in the United States. The Centers for Disease Control and Prevention estimates that today about 20% or 1 in 5 children aged 2 to 19 years have obesity. In fact, 8 to 10% of teenagers in the United States have gained enough weight that it threatens their current health and meets the medical definition of having severe obesity. The increases we've seen are due in large part to changes in the way we live and our environment, our food supply, how we get around, and our reliance on technology. For example, we use cars and public transportation more than we walk or use a bicycle. We get much of our food from grocery or convenience stores where there's an abundance of tasty and affordable but highly processed options with lots of added sugars. We're also using electronics more than ever before, sitting still and not moving our bodies as much as past generations. These things, along with just living busy and stressful lives, which contributes to poor sleep habits, also promotes weight gain over time.
Unfortunately, obesity is associated with multiple health complications. Having excess fat on the body increases the risk for many organ systems to start working improperly. Conditions such as sleep apnea, joint pains, high cholesterol, high blood pressure, type 2 diabetes, fatty liver disease, and even certain kinds of kidney conditions indeed are caused by obesity.
We know that having obesity also affects mental health. Many young people who have obesity deal with bullying from peers or even from loved ones and family members. Weight bias and stigma exist throughout our society and message to persons of larger body sizes that they have done something wrong and that their struggles with weight are a personal failure. Additionally, for young people with excess body weight, it can feel physically more demanding to move through life, more tiring with more aches and pains. All these things have a cumulative negative effect on a child's mental health.